For most patients, it is a progressive disease. And well, of course, whenever you get to degree 3, you go through 1 and 2. So something happens. What we notice is that in several patients, the degrees progress up to a certain level, then it doesn't progress further. But it becomes a risk factor for other things. So these patients with dry eye can get in an easier way infections or other problems. So it's just because you don't have the flushing effect of the tears in front of the eye, so you don't clean the surface of the eye. So maybe it's not that the dry eye is getting worse, but the ocular surface becomes to have, starts to have more and more problems. That's all. Classically, in Europe, the dry eye person was a lady over 50s, and so it was a rather classic picture. Now we are facing a small but consistent difference in the sense that we are seeing younger people involved. Those are the people that I call multi-screen dry eye patients, because most of us, for work and for leisure, we stay and watch screens all over the day. And it's been calculated that more or less we work 8 hours a day with the screen. So for many of us, it's more than the sleeping time. so something happening, because whenever you watch a screen and you are very concerned what you're doing, you don't blink. So the surface of the eye will dry because of evaporation, and you get all the problems. Contact lens problems has always been linked to dryness, but especially now, when the quality of the contact lenses there is so much, and that the perfection of the lenses, the way of using the lens has improved a lot. So the main problem for tolerance of contact lenses now is becoming the tear film stability. So we are facing, because of the environment we have, and because of what I've said before about the screen we are facing now more and more problems related to loss of tear and evaporation, and so instability of the contact lens on the surface and complication in using contact lenses. So tear film problems are a problem for contact lens wearers. Glaucoma patients are a very selected group of patients, which are, they have to put a number of drops each day for the length of life. And sometimes one drop is not sufficient. You have drop to drop. Many of these drops have some problems in the, pharmaceutical component itself, and some problems are linked to preservatives that are used to maintain the efficacy of the treatment. And so if you add one drug after the other, at a certain time the ocular surface began to be inflamed and the tear film stability decreases. And these patients, most of the patients refer the problems to the disease. They say, this is my glaucoma. But now we are realizing and explaining them that this is the fact that they put in so many drops for so many years in the eye can be a problem for the tear film. So treating the tear film, treating the inflammation related to tear film problems in glaucoma will help the glaucoma patient to use more accurately the therapy. So improving their persistence and compliance in the therapy. And that will, in the time, result in a better quality of the treatment because they are more consistent. So it's important that we realize the ocular surface problem and we explain the patient how to deal with it because they will become a better glaucoma treated patient. Unfortunately, not really. Well, they are aware of it because the patient is coming complaining. But they're not not the classical disease that the ophthalmology want to see, mostly because we don't have effective treatments. So we know that our patient is not going to be completely satisfied of our treatment. So we prefer not to see these patients. But we have to face a problem, especially after surgery. Because sometimes you do perfect surgery, but the patient is not happy. It's not happy because the surgery itself, but mostly I think the treatment, the drugs we have to put before and after the surgery induce an imbalance of the ocular surface system. So the ocular surface system goes into a vicious cycle leading to dry eye, leading to symptoms. And so the patient will complain about the surgery, but indeed the surgery is not a culprit, but the patient just had a marginal dry eye before. And so if you don't say it before, the patient will say, well, that surgeon did a bad surgery on my eye. So we have to be more aware of the problem. Well, we know that refractive surgery, the most evolved refractive surgery, cuts some nerves. And this, well, in some patients, not all, luckily not all the patients, can result in what we call neuropathy, neurotrophic keratopathy. And neurotrophic keratopathy will bring two things. One, that epithelial cells move slowly because the nerves are very important for production of new cells. And the second one is if you have a lower level stimuli on the cornea, you are going to have a poor tear film in front of the eye. And this will induce, so they will induce, luckily just for a certain amount of months, a tear deficiency in front of the eye. Some patients, unfortunately, will become chronic dry eye after that, and that's the problem. So we explain the patient, sometimes it's very important to treat the patient before the surgery, to put the inflammation, the risk of inflammation very low, so the epithelium will be better and will heal more rapidly. So that's the problem. Well, there is some, expansion of the attention to this problem, and not so many now, at least in Italy, but there are increase in these specialized centers for dryness because the patients are requiring them. And so this is important because we have to face, the need of the patient, because we are becoming very sophisticated, and we want to use the eye. Never in the history of humanity the eye has been so important. So the patient wants the perfect eye and the quiet eye and very good vision. Well, the symposium showed that there is a need to understand better the disease, to see the patient, to go toward the patient in understanding their needs, and we have to be very, very, informed that we have to treat all the components of the vicious cycle that maintain the dry eye, epithelial defect or malfunction, tear instability, and inflammation are the main problems. So the doctors should treat all the three together in order to rebalance the ocular surface system. Otherwise we are just correcting something, but there is something else going on.